Hello everyone. Today we are going to learn about MTP, Medical Termination of Pregnancy. Myself Vinoli, lecturer from Triplam College of Nursing. Let's get on to the video. Before moving to the session, let's see the specific objectives of the topics. First, introduction about MTP, definition, Medical Termination Pregnancy Act 1971, legal abortion, indication about MTP, first trimester termination of pregnancy and surgical methods, menstrual regulation equipments, vacuum aspiration, dilation and evacuation, second trimester termination of pregnancy and surgical methods, hysterectomy, and complication of MTP. Introduction about MTP. Medical termination of pregnancy refers as the induction of abortion. The induction of abortion may be legal and illegal. There are many countries in the globe where the abortion is not yet legalized. In India, the abortion was legalized by the Medical Termination of Pregnancy Act of 1971 and has been enforced in the year April 1972. Definition about MTP. The deliberate termination of pregnancy either by the medical and surgical method before the viability of the fetus is called induction of abortion. Medical Termination of Pregnancy Act 1971. The Indian abortion laws falls under the Medical Termination of Pregnancy Act, which was enacted by the Indian Parliament in the year 1971 with the intention of reducing the incidence of illegal abortion and consequent maternal mortality and morbidity. The MTP Act came into effect from 1 April 1972 and was amended in the years 1975 and 2002. Recently, the Supreme Court permitted a rape survivor to terminate her pregnancy at 24 weeks, which is beyond the permissible 20 weeks limit prescribed under the Medical Termination of Pregnancy Act 1971. Legal abortion. Termination is performed by the medical practitioners assisted in at least 25 MTPs and degrees in OBG course by the Act. Termination is done at the place approved under the Act, and termination done for conditions within the gestation a week prescribed by the Act. The abortion has to be reported to the Director of the Health Services of the state. Indication for the MTP. So first, women whose physical and mental health were integrated by the pregnancy can go for the MTP, and women facing the birth of potentially handicapped or malformed child can go for the MTP, and rape cases and pregnancies in unmarried girls under the age of 18 within the consent of the guardian can go for MTP procedure, and pregnancies that are the results of failure in sterilization procedure. After the sterilization, getting the pregnancy, unwanted pregnancies, the people go for the MTP procedure. First trimester termination of pregnancy, which means methods of first trimester abortion. So here first using the mifepristone and misoprostol. So mifepristone 200 mg an analog of progestin acts an antagonist blocking the effect of natural progesterone. Addition of low dose prostaglandin 800 mg improves the efficiency of the first trimester abortion, and it is effective up to 63 days, and it is highly successful when used within the 49 days of the gestational age. Methotrexate and misoprostol. Methotrexate 50 mg IM before 56 days of gestation, followed by the 7 days of later the misoprostol 800 microgram vaginally is a highly effective one will be given, and misoprostol may have to be repeated after the 24 hours if it is failed the MTP procedure. Then the methotrexate and misoprostol regimen is less expensive but takes longer time then mifepristone and misoprostol. Next, coming to the surgical methods of first trimester abortion. The first procedure is menstrual regulation, which means it is the aspiration of the endometrial cavity within 14 days of missed period in a woman with a previous normal cycle. The operation is done as an outpatient or an office procedure, and it is done with aseptic precautions. After introducing the posterior vaginal speculum, the cervix is situated within the Alice forceps. Then cervix may be gently dilated using 4 or 5 size dilators. The cannula is rotated and pushed in and out, gentle strokes can do, and then the operator should examine the aspirated tissues by floating in a clear plastic dish over a light sources. This will help to detect a failed abortion, molar pregnancy or ectopic pregnancy. And 5 to 6 section cannula is then inserted and attached to the 50 syringe for the section procedure. Then the procedure is contraindicated in the presence of pelvic inflammation. The syringe for using the menstrual regulation procedure equipment, and which is having the plastic cannula with a whistle tip used in the section evacuation procedure. The second surgical method is vacuum aspiration, which means done up to 12 weeks with minimal cervical dilation, and it is performed as an outpatient procedure using a plastic disposable common cannula. Up to 12 sizes can be used, and 60 plastic double wall syringe also can be used. It is a quicker procedure, 15 minutes will be done, and it is an effective procedure, 98 to 100 percentages effective as vacuum aspiration, and which is less traumatic and safer and dilation, evacuation and cutages. The procedures may be manual vacuum aspiration or electric vacuum aspiration also can be done. Procedure is first the hand operated double wall plastic syringe is attached to the cannula. Then the cannula is inserted transcervically into the uterus and the vacuum is activated. Then the negative pressure of 66 Hg is graded in the cannula. Then aspiration of the products of conception is done. Third surgical procedure is dilation and evacuation, which means DNC. The operation consists of dilation of the cervix and evacuation of the product conception from the uterus. Procedure: vaginal examination is done to note the size and position of the uterus and to note the state of cervix. Then USG should be performed when there is any doubt about the gestational age. Then posterior vaginal speculum is introduced and assistant is asked to hold it. The anterior lip of the cervix is to be grasped by an Alice forceps. Then the cervix may have to be dilated with a smaller size gratitude metal dilators up to one size less than of the suction cannula. Then feeling of snap of the endocervix around the dilator is characteristics. Instead laminaria 10-12 hours before osmotic dilator or misoprostol for 400 mg given vaginally 3 hours prior to surgery, which produce the effective dilation of the uterus. Then intravenous methagen 0.2 mg is administered. The appropriate suction cannula is fitted to the suction apparatus by the thick rubber or plastic tubing. Then cannula is then introduced into the uterus. The tip is to be placed in the middle of the uterine cavity. The pressure will be giving. The pressure of the suction is raised to 400 to 600 of Hg, and then the cannula is moved up and down and rotated within the uterine cavity 360 degree within the pressure on. Then the suction bottle is inspected for the products of consumption and blood loss. The suction is regulated by the finger placed over a hole at the base of the cannula. The end point of suction is denoted by no more material is being sucked out, gripping of the cannula by the contracting smaller size uterus, then appearance of bubbles in the cannula or the transparent tubing after being satisfied that the uterus is remaining firm and there is a minimal vaginal bleeding. The patient is brought down from the table after placing the sterile vulval pad. Coming to the second trimester termination of pregnancy. So the first medical method in the second trimester of pregnancy. So first they will be giving the prostaglandin. They act on the cervix in the uterus, and the prostaglandin, for example, is dinoprostone, sulfrostone, gemiprost, misoprostol, and other prostaglandins. Carboprost analogs are commonly used, and the prostaglandins are preferred as they have more selective actions on the myometrium and less side effects. Next medical method is misoprostol, which is given 400 to 800 microgram of misoprostol is given vaginally at an interval of 3 to 4 hours is most effective as the bioavailability is high. Then alternatively, first dose of 600 microgram misoprostol given vaginally, then 200 microgram orally every 3 hours are also found to optimum is given. Then recently 400 microgram misoprostol is given sublingually every 3 hours for a maximum of 5 doses. Then this regimen has got 100% success in the second trimester of the abortion. Then the third medical method is gemiprost. So here first 1 gram vaginal every 3 to 6 hours for 5 doses in 24 hours has got about 90% success. Then the mean induction abortion interval was 14 to 18 hours. Fourth medical method is mifepristone and prostaglandin method. So here, mifepristone 200 mg oral followed by 36 to 48 hours later by mifepristol is given, and 800 microgram vaginal, then mifepristol 400 microgram oral every 3 hours for 4 doses is used. Then success rate of abortion is 97% and median induction delivery interval is 6.5 hours is given. And pre-treatment with mifepristone reduces the induction abortion interval significantly compared to use the misoprostols alone. Then the fifth medical method is prostaglandin only. Here 250 milligram IM every 3 hours for a maximum 100 doses can be used. Coming to oxytocin method. Here high dose oxytocin as a single agent can be used for a second trimester abortion. Then it is effective in 80% of cases. It can be used with the intravenous normal saline along with any of the medications used either intra-amniotic or extra-amniotic space in attempt to augment the abortion process. And mode of action is myometrial oxytocin receptor concentration increases maximum 100 to 200 fold during the labor. Then oxytocin acts through the receptors and voltage mediated calcium channels to initiate myometrial contractions. Coming to the surgical method for the second trimester abortion. So here it is difficult to terminate the pregnancy in the second trimester with responsible safety as in the first trimester. So this procedure, which between 13 and 15 weeks is dilation and evacuations in the mid trimester, is less commonly done, and pregnancies at 13 to 14 menstrual weeks are evacuated, and in all mid trimester abortion cervical preparation must be used to make the process may easy or safe. An intracervical tent, mifepristone or misoprostol are used as the cervical priming agents. The procedures may need to be performed under the ultrasound guidance to reduce the risk of complications, and also simultaneously use the oxytocin infusion is useful for the patient. In the 16 and 20 weeks of the abortion, so here intra-amniotic and extra-amniotic procedures can be done. So first learn about the intra-amniotic one. Here the intra-amniotic installations of hypertonic saline 20% is less commonly used during the procedure, and it is instilled through the abdominal route. And mode of the action for this procedure, there is liberations of prostaglandins following necrosis of the amniotic epithelium and the decidua, and this is turn excites uterine contraction and results in the expulsion of the fetus. And coming to the procedures of between the 16 and 20 weeks of the intra-amniotic procedure. So here first primarily amniocentesis is done by 15 centimeter 18 gauge needle to be used. Then the amount of the saline to be instilled is calculated as number of weeks in gestation multiplied by 100 ml. The amount is to be infused slowly at the rate of 100 ml minutes. Extra-amniotic procedure. The extra-amniotic installations of 0.1% ethacrydal lactate done trans-cervically through a number 16 Foley's catheter used, and the catheter is passed up the cervical canal for about 10 cm above the internal as between the membranes and myometrium, and the balloon is inflated 10 ml with saline. It is removed after the 4 hours. The success rate is similar to saline installations but is less hazardous, and it can be used cases contraindicated for all saline installation procedure. Then stripping the membranes with the liberations of prostaglandins from the deciduous and dilations of the cervix by the catheter or some of the known factors for initiation of the abortion. Then coming to hysterotomy procedure, which is done by second trimester of the MTP procedure. Hysterotomy is an operative procedure of extracting the products of conception out of the womb before 28th week by cutting through the anterior wall of the uterus. The operation is usually done through the abdominal route, and the operation is rarely done these days for the purpose of the MTP, medical termination pregnancy. And after this procedure, some of the complications can be seen, like hemorrhagic and shock, peritonitis, intestinal obstruction. And other complications like immediate and remote complication. The immediate one is injury to the cervix. A cervical laceration will be happen, and uterine perforation during the DNC, and hemorrhages and shocks due to trauma, and incomplete abortion, and atonic uterus, or rarely coagulation failure will be happen, and thrombosis or embolism sometimes happen in the immediate stage. In the remote stage, the complications are grouped into two types: gynecological and then obstetrical types. Some of the complication can be expected. Gynecological complications include menstrual disturbances, chronic pelvic inflammation, scar endometriosis for 1%, and obstetrical complications include ectopic pregnancy, threefold increases, preterm labor, and dysmaturity and rupture of the uterus. I hope this video will be useful for everyone, and thanks for watching. I hope this video will be useful for everyone, and thanks for watching.